130. That is how many Americans die every single day from opioid overdoses. Any minute now, President Trump and First Lady Melania Trump will speak at a drug abuse and heroin summit in Atlanta, Georgia. It's a crisis that the president has vowed to tackle since he first took office. And now, for the first time ever, pharmaceutical distributors are being held accountable. On Tuesday, federal prosecutors charged Rochester Drug Cooperative and two of its former executives for their role in fueling the opioid epidemic through drug trafficking. Those executives were also charged with willfully failing to file suspicious order reports to the Drug Enforcement Agency, or the DEA. Prosecutors say the company ignored red flags and shipped millions of oxycodone pills to pharmacies they knew were distributing drugs illegally to help their profits soar. The lawsuit states that between 2010 and 2018, the company sold more than 143 million oxycodone pills to New York customers alone. On a nationwide scale, roughly 21 to 29% of patients prescribed opioids for chronic pain eventually misuse them. More than 90,000 people died from opioid overdoses in 2016 and 2017 combined. That number is higher than the 58,220 U.S. service members that died due to the Vietnam War. And get this, according to a report conducted by the National Safety Council, people are now more likely to die from an opioid crisis than a car crash.
Yeah, this is remarkable. Joining us now is New York Attorney General Letitia James. Good to see you again. Thank you for being with us.
Thank you for having me.
We're waiting to hear from the president on this. Is there something you're hoping to hear from the federal government, from the president, on dealing with opioids?
More resources across the nation. Any cuts that he has proposed, particularly cuts in the area of the National Drug Control Act,
right.
They need to be restored. They were cut in this year's budget. It's really critically important that he restore those funds. We need additional funding for Medicaid beds, recovery beds. We need education. A number of SAPIS workers are substance abuse workers in public schools. Unfortunately, they have been reduced significantly. It's really critically important that we focus on prevention, education, detection, as well as treatment. And we need to talk about medically assisted treatment as well.
Why have there been cuts since the crisis is only growing?
That's a good question, and I can't answer that. I can only tell you about all of the individuals that I've met across the state of New York who have urged me to file a lawsuit against manufacturers and distributors, and as well against a family that benefited from this crisis. Every day in New York State, 9 individuals die, and as you mentioned, across this country, 43 individuals died. As of today, 47,600 Americans have died as a result of an opioid-related death. It's an epidemic that we need to gain control of, but the only way we can do it is when all forces, when all levels of government get together and ensure that we have the necessary resources to address this, because this is an epidemic that knows no political affiliation, knows no race or ethnicity or geography. It's affecting all of us.
Or economics. I mean, we just hear victims from all across the spectrum. The milestone yesterday in the charges against RDC was interesting in that it's similar to what we've talked about with Purdue Pharma, right?
Yes.
It's this idea that the company was made aware of or had data that they can't possibly be sending these drugs, in the case of RDC, to a pharmacy in Woodbury, New York, that was buying these drugs at a rate that just didn't make sense. It wasn't logical. And yet, when brought to their attention, they allegedly said, don't worry about it, keep going.
And what's their legal obligations?
They failed to exercise their duty, particularly as it relates to detecting and preventing drugs from going into unlawful hands. And unfortunately, they ignored all of the red flags. And the protocols that were put in place were unfortunately not managed. They were not properly funded. And in situations, pharmacies dispense millions and millions of pills and other drugs to individuals who were addicts.
But is that a criminal violation, right? If you look at in banking, you need to get a license, and you need to follow know your customer protocols. And if you don't, you could be in violation. You could go to jail.
Yes.
In pharmaceuticals, what are the rules for an executive?
So yesterday, as you know, the Southern District announced charges against Rochester Cooperative, and they entered into a settlement where the corporation would pay $20 million, and a prosecution agreement was put off. Then there were private individuals, the CEO and other officers within Rochester, that were charged with criminal charges personally, and those cases are still ongoing. And so it's really critically important that individuals know that in New York State we have a Substance Abuse Act, and it speaks about ensuring that corporations, that pharmaceutical companies, that manufacturing companies are doing all that they can do to identify red flags and respond to red flags, and whenever there's any suspicious orders, that they alert the pharmaceuticals
and in this case, there were red flags, and they did see them, and they did ignore them. I think they passed about 4 of them on out of 800. In the case of your lawsuit against Purdue and the Sackler family, the Purdue has put out a statement saying that you're going after former directors of the company. They're making it look like, why would you go after people who aren't even involved in this company anymore, and that you're going after this family?
The Purdue company was owned, managed by the Sackler family, and they made millions, if not billions. They've diverted their profits to offshore accounts. They illegally transferred funds to their personal accounts. So it's important that we hold the Sackler family responsible. Purdue introduced to the market back in 1997 OxyContin, which is responsible for this crisis, this epidemic across our nation. And clearly Purdue, the Sackler family, the manufacturers, as well as the distributors need to be held accountable. Our lawsuit is civil in nature. The lawsuit that was filed yesterday by the Southern District is criminal in nature. The bottom line is that individuals need to be held responsible, and resources, we need to put forth remedies as a result of their financial settlement, remedies that would, again, focus on treatment, prevention, education, and detection.
So one of the things, when we think of this 130 people who die in America every day, and we think of the thing that it feels most like, and it was like the crack epidemic, which also became normalized and became part of our culture and became part of popular culture. And now that's sort of happening here, right? This is part of our culture. We know people die. We know they die across the socioeconomic spectrum. There's a danger in that, right? In not dealing with this as the crisis that it is.
Right. When you begin to normalize this type of behavior and you treat it like a criminal justice, when you focus primarily on criminalizing individuals, this is a public health crisis, and it should be treated as such. And so it's really critically important that we provide more recovery beds to individuals. As I traveled throughout the state of New York, there is less and less beds for individuals to recover from this crisis. We need to focus on schools. We need counselors in schools and individuals who can talk about controlled substances and prevent it from happening. And as early as grade school, there are individuals who have been addicted to these opioids as young as 10 and 11 and 12. And it's important that, again, we educate them and we do it as early as possible. And then last but not least, we need to provide more resources to law enforcement to interdict these drugs, both at the border and elsewhere. Individuals who are in the criminal justice system, we need to make sure that they are held accountable for causing this epidemic. But let's not lose sight of the fact that these manufacturers and these distributors and this family were part of a criminal enterprise, and they need to be held accountable for all of the individuals who have lost loved ones. Again, in the United States of America, 47,632 a day across this nation, and 9 a day in New York State.
It's amazing. All right, Tish James, thank you. No,
10, 11, and 12-year-olds.
This thing knows no boundaries. Hey, MSNBC fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down there and click on any of the videos here to watch the latest interviews and highlights. You can get more MSNBC for free every day with our newsletters. Just visit msnbc.com/newsletters to sign up now.